Greetings everyone and a warm welcome to Addis Dialogue. In this edition, I'll be spending some time with the Israeli ambassador to Ethiopia, Raphael Morav. We'll be talking about the bilateral ties between Ethiopia and Israel and also their cooperation against COVID-19, among other issues. Do stay with us. Ambassador, as usual, thank you very much and a warm welcome to this show.
It's a pleasure to be invited to your show, and thank you very much for inviting me.
Let me start off with this question. What are some of the things that's going on here at your embassy in order to keep you and the staff safe and secure from COVID-19?
Okay, so since the outbreak of the COVID-19 in Ethiopia, we started to take a measure of social distancing. We have divided the team of the embassy into two groups who rotate, so in a way that if someone is contaminated, infected, so he will not infect the others. And the normal social distancing measures that later on were also imposed in Ethiopia. And it works pretty well. The fact is that so far we have no one who was tested positive, and we try to keep working as normal as possible under these circumstances. And of course, our work is mainly focused on and around the COVID-19 pandemic and cooperation with the Ethiopian government around this issue.
Unfortunately, Ethiopia is one of the victims of the coronavirus, which is having the whole world. What's your take on the efforts Ethiopia has so far taken to fight this global pandemic?
Well, first of all, I would say that in relative terms, Ethiopia is in a very good position with 272 cases up to now. I think it's very low, especially in relative terms of the population. If I look the government measures, I think that basically they are well adopted to the situation. On one hand, you have to strike the right balance between the health necessities and the economic and societal requirements, and the fact that on one hand there was no total lockdown imposed. I think it's something very important for the continuation of the economic activity. At the same time, the government is taking the proper measures to track and trace all the people who were contaminated. Maybe what is required, and I know that there are efforts done and improvement, is the test to be conducted. Today we have an average in Ethiopia of about 2,500 tests per day. It's much better than a month ago when we had around 700. But I think if more could be made, it would give us a much better and more precise picture of the situation. And there is a capacity to reach at least 6,000 tests per day. So I think there is some improvement that could be done on that.
Now, the government of Ethiopia has put in place various preventative and precautionary measures against COVID-19 in order to stop the virus from further spreading. Although lots of people are dutifully adhering to the rules and regulations put in place, there are still some segments of the society which pay little attention to it. Are you somehow concerned about this?
Well, there is, on one hand, a matter of communication. Ethiopia is a very big country and mostly rural population, so you have to reach all this population through the electronic media, but also the traditional media and other means, so that people are well aware of the danger. And then, when there is awareness, they can take the proper measure. And of course, you need also to, in the cases necessary, to impose the measures. So maybe on this there's still some work to be done. And then, of course, you have to concentrate on regions where you see an outbreak of the virus. And so we have, of course, mainly in Addis Ababa, but also in Dirdawa and in other regions. So they should be tackled on a punctual basis. So there is a treatment which is national one, there's one which is regional, where you see outbreaks of the virus, and then there's the personal one, which is, of course, if someone who is tested positive, so then he has to be in a quarantine. This a source of concern is with these big isolation centers that are now in Ethiopia for those who are returning, especially from the Djibouti and Gulf countries. I hope that the precautions are taken in order that these isolation center will not become a place where, on the contrary, the virus is spread out. So this is a challenge that the government and the health authorities have to tackle.
In its worst scenario, if this disease continues, should Ethiopia, just like other countries, declare complete lockdown in the country?
Well, I don't think there's one solution that fits all, and each country, according to its social, economic, and health conditions, shall decide on the proper measures. I think that in Ethiopia, there's the right balance between the economic and the social and health requirements, and therefore there was no need to impose a total lockdown. Mind that in the public sector, actually, most of the people are working from home, so that's right. At the same time, in the private sector, people continue to come to work. So I don't, and as I judge according to the results and the spread of the infection, so far I don't think that there's any need for more strict measure, especially not total lockdown. I think that it will make a much bigger economic harm to the population. And also there's a question to impose it, which is also a challenge.
Now, what are you doing as embassy here in Ethiopia to help the nation in the fight against COVID-19?
Okay, so first of all, we have regular contacts with the Ministry of Health and the Ethiopian Public Health Institute in order to identify the needs, and then we know how can we supply. And actually, we have produced in Ethiopia an Israeli design face mask that we are going to deliver actually next week to the cardiac center of Ethiopia, and that is just the first delivery because this, as I said, it can be locally produced, so as the need will arise, we will be able to produce more, and also it gives some work for local business, so we're very happy to continue on that. The face mask, actually I have here just samples, you see. So this is designed in Israel and produced here in Ethiopia with a 3D printing machines, and you just put it like this, and you are well protected. Of course, you have also to put the mask. So this is mainly for the medical staff. Okay, not for the general public, but very important for the medical staff in the hospitals and clinics and those who are coming in contact with people who are suspected to be contaminated. The design, as I said, is Israeli, and it is produced. We just brought the design to Ethiopia, and with 3D printers, we produced it here.
So it will be produced here, and
yes, it is already. We're going to contribute, as I said, 200 pieces to the cardiac center. And in the future, we will produce even more, and then we will be able to give it to the big hospitals. And we expect a delivery of PPE and medical equipment from Israel next week. I cannot yet announce the exact amount and the contents, but this is something that is due to come next week. And also we are now in the process of bringing a delivery from China, also of medical equipment and PPE to the Ethiopian authorities. So there will be maybe more news in the coming days and weeks on that. But we do it as I said, in coordination with the public health authorities in order to respond to the most immediate needs.
Now, Ethiopia and Israel have had excellent medical ties. Of course, the two countries have lots of areas of cooperation, and they have been enjoying it for a long time. But medically speaking, the children's cardiac treatment is a case in point. Uh, what's the latest development in this regard?
Well, actually, I'm very pleased to announce that we will resume the operations of Ethiopian children in Israel. And first of all, last week or 10 days ago, we had the Ethiopian treated children who were in Israel in a lockdown, like all the rest of the population. They have now returned to Ethiopia, as I said, last week or 10 days ago. And we have now the approval from the Israeli health authorities to allow a new group of Ethiopian children to come to Israel for heart operations. So that's really very good news that I'm happy to announce today. We are more than happy to train the medical as well as the management health authorities in Ethiopia. We made actually already two webinars to the Ethiopian health decision makers, and it was very successful. One was with the Israeli Red Cross, we call it Magen David Adom, and the other one was more focused on the Israeli experience from a clinical point of view. We also offered some technological solutions to Ethiopia especially about tracking and tracing the cases, because we have some, I think, cutting-edge technologies in this field. And if there's there are more requests, maybe more punctual one, of course we'll be more than happy to provide it to Ethiopia.
Now, what's the cooperation between Ethiopia and Israel like in other areas?
We have the ongoing what we call smallholder horticultural project, which is focused on the introduction of avocado high quality varieties in Ethiopia, and it goes very well. This project is now running for 13 years, and Ethiopia is already an exporter of avocado to Europe. It goes very well, and therefore we are now in the phasing out phase of transmitting it to the Ethiopian authorities. Tender was published and is about to be closed down at the end of this month in order to actually to select the company or entity that will continue the management of the project and also will invest especially in the value chain for export. So that's a very good and successful project. Otherwise, we have other projects, if we're talking about, well, coming back to health, so we have an Israeli NGO called Nala that, especially during this period, has produced water pumps that you operate with the foot, and they were installed in various schools all over the country, so that children will be able to wash their hands and keep on the hygiene instructions that we have to follow during this period of COVID-19. As a follow-up of the Prime Minister Abiy visit in Israel, there were three fields that were decided to concentrate on. One is wheat culture in lowlands in Ethiopia, and the second one is aquaculture development, and the third one is cyber security. So on the two issues, the two first issues, which are related to agriculture, we have already sent in January a fact-finding mission that visited the sites of the wheat development and culture in the lowland. I went with them actually in Afar region along the Shebele River. And there will be also sites in Somali region and also in the Omo Valley, and at the same time the team also visited places for aquaculture. And the idea is that to create a center of excellence in Ethiopia for wheat culture in lowland, which means irrigated wheat. That's the main development, because there's already wheat culture in Ethiopia, but in the highland using just the rain-fed. Yeah. So this one will be using modern technologies from Israel. It can be probably sprinklers and or drip irrigation, And also the idea is to establish a training center for our aquaculture that will be next to a production of fish. In Ethiopia, there's a very good potential, especially for tilapia, and the consumption of fish in Ethiopia is very low, so there's a huge potential also, for the diversification of the nutrition of protein intake in Ethiopia. The third issue of the cybersecurity, actually just before the COVID-19 crisis, we're supposed to send also an expert mission to Ethiopia. It was already agreed about the date, but then we had to suspend it due to the crisis, and we hope to resume this initiative as soon as the crisis will be over, and to establish cooperation also in this field.
What is the situation like in Israel when it comes to COVID-19, and how is it affecting the country?
Well, in Israel, we are now at the stabilization phase, which means that we are after the total lockdown that was imposed for 2 weeks, and now we start opening again the economy. Actually, schools will reopen next week, but still there are limitations. You cannot go to the beach, for example. People who go to work and are encouraged to go back to work, so they have to keep on social distancing. And for example, in the public administration, you still have to work on rotations. So it can be day and night shift, or one day at home, one day in the office. So we see now reduction of the new cases, and what is more important, a very important reduction of the death cases. So today I think we have only, on average, 3 new death cases, which is very good compared to a month ago.
Now, Israel is taking this global challenge as an opportunity, coming up with new developments and innovations, tech solutions against the pandemic. Are there new developments in this regard?
As I mentioned, we have developed technological solutions, okay, for tracing, especially all the social contacts of those who are found infected by the coronavirus. So it is mainly based on the geographical position of the patient who was infected, and through the tracking of his movement and his social contacts, you can know who were in contact with him, and then to warn these people, first of all, to go into isolation, and later on to eventually to make a testing. That is one thing. Another thing is using telemedicine technologies for the diagnostic. So because the idea is that people shall not reach the hospitals if they are contaminated. On the other hand, if there are symptoms, you want to reach them and to be able to test them and eventually to quarantine them. So there is an application that you can download, and using artificial intelligence, it will make all the diagnostic of your symptoms and decide if you have or not a risk of coronavirus 19. And if there's a risk, so then automatically the health authorities will come to you and will make the test. The added value of this solution is that you can have since you have the geoposition of the patient, so you can see whether you have clusters of contamination. So these are 2 very useful solutions that we have developed in Israel and are widely used in Israel.
I also heard Israeli scientists and entrepreneurs are all over the world contributing their share to this, to the fight against the virus.
Yes. And of course, we are also making research to find the vaccine, because that's the main challenge if we want to eradicate the virus. So there are some interesting research, among others using stem cells But you need, in order to really to be able to announce that there's a solution, you need much more time. So like in the rest of the world, it take about I think 1 year till we have a vaccine that is proven efficient and safe and useful.
Let's also talk about the Grand Ethiopian Renaissance Dam. In the midst of this global pandemic, Ethiopia is building the biggest dam on the continent. What's your take on that?
Well, I think that there's no reason that Egypt, Sudan, and Ethiopia will not be able to resolve this issue through negotiations. And actually, there was a process of negotiation last year, as we remember. And I think that the three sides should return to the table with or without the assistance of a third party. It's up to them to decide, but I think that a solution is at reach, and I'm looking forward that this will be resolved in an amicable way.
And finally, as ambassador to, and also as a good friend of Ethiopia, what's your message to Ethiopians?
Well, first stay strong, safe and healthy. I think that this crisis will be overcome. I trust the government and the people of Ethiopia that they are taking the right measures and are going to overcome this hopefully in short time.
Well, Israeli ambassador to Ethiopia, Raphael Morav, thank you very much for your time and your perspectives.
It has been a pleasure, Israel. Thank you very much.
Well, dear viewers, that was Israeli ambassador to Ethiopia, Mr. Morav, talking to us. Thank you very much for your time and your company so far. Until I see you with another program, it's goodbye from me. Bye-bye.